Medications like semaglutide and Tirzepatide are demonstrating incredible efficacy in the clinical management of obesity and long-term weight reduction. These dual receptor agonists mimic natural gut hormones, traveling to the brain to dim the appetite center while slowing gastric emptying. The result is a profound suppression that creates a deep caloric deficit, causing the scale to drop with remarkable speed. While these medications solve the hunger equation, their efficiency shifts the body's internal priorities toward a specific form of biological depletion. There is a common misconception in medical weight loss that a dropping number on a scale represents pure fat loss. Total weight loss combines fat mass and fat-free mass, or lean muscle. A significant portion lost on GLP1 therapies comes from this vital, highly active tissue. Losing muscle directly lowers the resting metabolic rate, causing the body's internal engine to burn energy less efficiently. For the patient, this translates into burning significantly fewer calories at rest and experiencing a sense of physical weakness. Unchecked, rapid weight loss from GLP1 therapy can damage the metabolic engine, creating a biological environment that favors future weight regain. Avoiding that outcome requires patients to proactively control the composition of the weight they are losing. The American Heart Association and the Obesity Society recommend a baseline of 150 minutes of aerobic activity per week, which is intended to produce an energy expenditure of 1,000 extra calories. This can be achieved in intermittent 10-minute bursts, like a brisk walk up a flight of stairs, making it easier to integrate into a busy schedule. While cardiovascular exercise is essential for heart health and caloric expenditure, it does not solve the problem of lean tissue loss on its own. The CDC recommends that adults engage in muscle-strengthening activities at least 2 days a week. This cellular view illustrates the biological mechanism. Resistance training creates mechanical stress that commands the body to preserve lean tissue, even during a severe caloric deficit. Preserving this fat-free mass protects the resting metabolic rate, offsetting the metabolic slowdown that usually accompanies rapid weight loss. A standard dieter and a resistance training GLP1 patient may see the same number on the scale, but only the latter keeps their metabolic engine active. Strength training is a targeted medical intervention used to counteract the side effects of these medications. Resistance training dictates exactly what the body loses, ensuring the medication burns away fat rather than cannibalizing the metabolic foundation. The most difficult phase of obesity management arrives after the initial weight loss, the long-term maintenance phase. To prevent regain, the required activity level skyrockets. Patients in the National Weight Control Registry often engage in 1 hour of activity per day to maintain their results. This creates a danger zone for those who lost significant muscle mass during the weight loss phase. If a patient's physical endurance has plummeted, completing 300 minutes of exercise per week can become physically impossible. A patient who preserved their muscle through strength training maintains the endurance necessary to meet these high maintenance demands. Semaglutide and Tirzepatide function as biological tools that require an active physical partnership to achieve long-term success. Resistance training should be viewed as a mandatory co-prescription alongside the medication. True metabolic health is achieved by balancing the chemistry of weight loss with the physics of muscle preservation.